wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
Lulu Money, Snehapurvam.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Do not let illness make you realize the value of health. Good evening, viewers. Welcome to today's episode of BMC Global Live Hilal Health World. Nothing but lifestyle. As I always keep repeating, the journey from illness to wellness would mostly require a change in our lifestyle, and we are here to create awareness on different health topics. The topic for discussion in today's episode of Health World is iron deficiency anemia. Something that concerns many of us, but something about which we have not heard much. And definitely we have a very apt doctor joining with us today, a family medicine specialist with over 10 years experience in this field. I welcome Dr. Umnia Mohammed Elfatih Ahmed. She has completed MBBS and MSc Family Medicine from Gazira University, Sudan. Definitely, she has been building relation with different people from different age categories, starting with children, adults, youngsters, elderly, and so on. Definitely, she will be able to answer to all our queries and give us insights into this topic. She is currently working at Al Hilal Hospital, Salmabad branch. So let us move on to today's topic. Good evening, doctor.
Good evening.
Welcome to today's episode of Health World.
Welcome. Thank you so much.
Doctor, firstly, let me ask, when we asked you to join for our Health World episode, you chose the topic iron deficiency anemia. Why was it so?
Yes, actually I chose this topic, iron deficiency anemia, because in my daily practice as family medicine specialist, I saw many patients complain of they have different complaint, but at the end I discover they have iron deficiency anemia. Among different age groups, from the children, adults, and elderly, also male and female, they suffering too much from this problem, iron deficiency anemia. Actually, iron deficiency anemia is the global health problem. It affects many people. Even WHO said like more affected population. It is estimated that 30% of women in reproductive age complain of anemia. And also children less than 5 years or under 5 years, 40% of them complaining of iron deficiency anemia also. Okay. If we talk about anemia, what is anemia? Simply, anemia is when we have low hemoglobin level in our body, or decreased number in red blood cells count, or both of them together. This we call anemia. When we come iron deficiency anemia, this means we said iron deficiency anemia. It means that our body there is lack of iron. What is the importance of ions? Actually, we need ions for synthesis of hemoglobin. Hemoglobin is important for carrying oxygen to our tissue, so that if any decrease in ions, our body cannot synthesize enough amount of hemoglobin, and we suffer from iron deficiency anemia. Even for the word anemia is the Greek word. It's composed of two parts, and hemic. Anemic. Anemia, it means lack of blood. Okay, these two parts. This regarding about the name of anemia.
Okay. Thank you. So, doctor, my next question is, how do we know that we are suffering from anemia?
Okay, actually, first at the beginning, you may not notice any symptoms, because your body there is a storage for iron. So your body is try to utilize this storage of iron to meet enough amount of hemoglobin requirement. But with time, when iron is become very low and your body cannot get enough amount of iron, in this stage we start to feel some symptoms. Example, you feel tired, fatigue all the day, you cannot do daily activities, and after that loss of power you have. Sometimes you have dizziness, you feel and headache also. You can for children, they have loss of appetite. They don't want to eat anything like this. Could be this they have anemia also. Could be also they have some chest pain and increased heartbeat, which is called palpitation. Also you can get these symptoms also. If someone concerned about beauty, of course they feel like brittle nail and hair loss. Also sometimes you can feel this one. There is also some, actually you can suffer from craving for nutrient substance, for like paint, dirt, ice. Sometimes people try to eat this one. It should be investigated for iron deficiency anemia. Sometimes you have in the tongue also recurrent infection, glossitis, and also there is the angular stomatitis. I mean, like sometimes you have in the corner of the mouth. Okay, you have some small cuts like this. Okay, all this anemia. Also, you feel muscle weakness, and this especially when you walk for distance, you feel like muscle cramps in legs, also like this, or spasm in the leg. Okay, so many clinical feature. Actually, we face this for pregnant women also. If they have premature baby, or if they deliver, they have a small for weight, like small babies they deliver. Even the baby when born, they have not enough iron storage, so will face problem from his birth. Will be like growth retardation. He cannot grow with their children in his same for age like this. Many complication, actually, many clinical presentation could this anemic patient can present with.
Doctor, so you spoke about the different symptoms that anemic patient can present with. Earlier you were mentioning that much percentage of women complain about this, even children. So let me ask, in what age categories anemia is more, and male or female, and what could be the reason behind that?
Thank you, sir. This is a good question, really. Actually, because in children they need their body need they have more demand for iron, need for growth, for activity also they need iron. That's why children, especially under 5, they more prone for iron deficiency anemia. Also women at reproductive age from 15 till 49 years of old, because of they have menstruation, because menstrual cycle every month we lost amount of blood also in as breastfeeding and pregnancy. This will increase demand, so women are more affected and children. It's more categories, that's why, because they have increasing demand for.
Doctor, mentioning about women, I think iron deficiency can cause many troubles in the menstruation cycle, isn't it?
Yes. Sometimes could be they have heavy menstrual cycle. If low hemoglobin, it's cause heavy menstrual cycle, and vice versa. Heavy menstrual cycle in anemic women, it's become more heavier. So this will be like precious circle. We need to cut it by identify and treat the anemia.
Yes, doctor. Doctor, another question that comes up is, if we ignore this anemic symptoms, and if we don't seek medical help, what could be the complications?
Actually, because if you not seek any medical help, anemia will go on to be more worse. Like if you have fatigue, this definitely will affect for the daily activity, and even for work. You may be absent from work, you cannot do your work properly. And if you feel like low mood because you don't have power, and sometimes you can get in depression, like it's only from anemia. And also for children, as I mentioned before, maybe they have low birth weight, or from the developmental delay also, and also for cognitive function. Memory also will be impaired. All this, and again also for sometimes if you're not treated, you can develop anemic heart failure or congestive heart failure. All this from anemia. Simply we can treat it, but if we ignore, too much problem could happen. Also, there is some change, nails change, sometimes destruct the nail. We call like a spooning of the nail, or name colinekia. All this coming from anemia itself. If not treated, too much complication, and also you can go in chronic renal failure, and many sequelae of this iron deficiency anemia could happen.
Okay, doctor.
Also, people will be more prone to infection, and they have low immunity. So any infection faster than other people, which have not anemia.
Definitely, we have only dealt with few basic questions. What is anemia, and why it is important to seek medical care for the disease. We have to know how to detect anemia, and much more about this topic. But we will be back after a very short break. Stay tuned.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry. Our story, our pride.
NEC Rabbit. Send money online to India. Credit in seconds with great rates. Download NEC Rabbit app now.
Lulu Money. Sneha Purvam.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Welcome back. You're watching BMC Global Live Hilal Health World. Nothing but lifestyle. Our discussion today is on the topic iron deficiency anemia. So let us proceed with the remaining queries. Doctor, you spoke about why iron deficiency anemia is important to be detected and taken medical care. So what test is undertaken to detect anemia?
Yes, actually, we assess the patient generally from history. We take proper history from the patient to find out what is the cause of anemia. And also we go through physical examination for the patient, and we complete our diagnosis by blood test or investigation. First investigation and simple we order it is complete blood count or CBC. Okay. In CBC we look for hemoglobin will be low. And all hemoglobin low will be according to WHO. According to WHO, hemoglobin in male less than 13 gram per deciliter, it's considered anemia. And female, it is less than 12 gram per deciliter. And for pregnant women, different will be like 11 gram per deciliter. Okay. Children have another classification also for hemoglobin. Okay.
Okay.
This first hemoglobin. After that, we will see this red blood cells count and indices for blood cells count. I mean, we see the volume of red blood cells count. Usually will be low. This size, because no enough iron, so the size will shrink, will be low. With this called, like, we call this microcytic. Okay. And there is also MCV, MCHC. Also, we measure the concentration of iron in this red blood cell. Okay. And also in CBC, is still not finished. We will see also reticulocyte count. Okay. Will be low in iron deficiency anemia. Also, this is my premature red blood cells, because our body cannot sense this red blood cells count, so no new RBCs will form. Okay. And also we check also, of course, white blood cells for infection, to rule out no infection. And platelets count. Platelets count we found normal, or sometimes will be increased in iron deficiency anemia, or in anemia generally. Okay. After this, after CBC, we will go for iron study or iron profile for a specific diagnosis of iron deficiency anemia. The important test here is ferritin. Ferritin, it is the iron storage in our body. Ferritin level less than 30 microgram per liter, it is diagnostic for iron deficiency anemia. Okay. And also, but the problem with ferritin, in some acute inflammation in our body, it could be high also. It could be high. So this it's we cannot really diagnose by this. We need to add another test for that one. Okay, like people have hepatitis, or have chronic heart failure, or chronic renal failure. This ferritin, we cannot depend on ferritin levels for diagnosis of anemia. Of course, we complete other iron profile, like we found low serum iron in the body. Okay. And also transferrin saturation will be low, with total iron binding capacity will be high. This all in iron profile. Okay. After that, we will do peripheral smear. Okay. And also we will do urine routine examination, and stool general. Also, we will do examination to rule out another cause of anemia, like worm infestation. And we do also occult blood tests for hidden gastrointestinal bleeding. Also, we'll do this test. Okay. Bone marrow examination, but usually in iron deficiency anemia we not reach to do bone marrow examination. But if bone marrow examination, we found no iron store in bone marrow examination. Any patient 50 years old or more, definitely if the cause of anemia not diagnosed, we should go for endoscopy to rule out no GI bleeding. Okay, no gastrointestinal bleeding, or no gastrointestinal malignancies also, because sometimes could be iron deficiency anemia manifestation for hidden gastrointestinal tumor. Could be most important investigation regarding anemia and iron deficiency anemia. Exactly.
Okay. Doctor, let me pick up one question that came in our helpline number. Yes, the question says, what are the causes of iron deficiency anemia? You pointed out a few causes when you spoke about the tests done.
Yes.
What are all the causes that can cause this anemia?
Sure. Okay, thank you for this question. After this first cause, if we not take enough iron, or we have increased demand in our body for iron. Example, for children, because they need more iron for growth, okay, for healthy growth for them they need, or women, pregnant women, or lactating women, they need more iron. Also in adolescent, especially for girls, lady, because they have menstrual at the beginning. Sometimes they facing irregularity or heavy menstrual cycle, so that need more demand. Or we take enough amount, but problem in our iron well. Actually, iron is absorbed in the small intestine, duodenum and jejunum. If have any disease in this area, we cannot absorb iron well. For example, if we have H. pylori infection or Helicobacter pylori infection, we cannot absorb. Same if we take a proton pump inhibitor like omeprazole or any class of this medication, it also affects absorption of iron, because iron for absorption we need acidic media. So it will be difficult for absorption. And also if someone have irritable bowel disease, or if you have celiac disease, so there is a problem in absorption. Or anyone did any stomach surgery, for example, gastric bypass surgery, or this, so they have problem in the absorption. Okay, if we have chronic blood loss could be physiological, like in female menstruation. Yes. Okay, every month she have menstruation. Or if we have donation, if someone make donations blood frequently, we may have also this one. Or if we have gastrointestinal problem, I mean we have hemorrhoid or piles, okay, or if we have peptic ulcer or duodenal ulcer, also this could happen. Or if someone take medication, it's make blood loss. For example, if he take aspirin or non-steroidal anti-inflammatory drugs like diclofenac, sodium, potassium, morphine, all this could cause chronic blood loss without knowing. Okay, many things for chronic blood loss. If chronic illness also, it could make iron deficiency anemia.
Doctor, so when you told about the causes, the first cause you mentioned is taking food which is low in iron. Or yes. So the next question, another question that came up in the helpline number is, what are the food rich in iron?
Okay, this is good question.
We need to know that.
Yes, to improve our to prevent anemia. Very simple thing. We should this food high in iron content like Spanish, very rich in iron. Okay, and grapes, pomegranate also, dates and raisins. This too much iron content. Also meat, liver, also this one. The important thing we should put in mind, we need to increase absorption for iron. Example, increase absorption by ascorbic acid. So if we take any food, you can just put some lemon on it. Simply of that. And if lemon will increase absorption, lemon, orange, lime, sweet lime, all this high. Generally, also berries, anything red in the nature, vegetable or vegetables or fruits, red in color, it's give us iron. Same also honey, honey, but for more absorption, just put some lemon on it. Okay, and also beetroot. Yeah, beetroot very nice, even antioxidant, very good. You can take it. So generally, this we follow this one, and to avoid that decreased absorption of iron. Example, if we take food rich in iron, but after that we drink a cup of tea or coffee, here we prevent absorption, because it's content of tannins that prevent absorption. Same calcium content food, milk. If we take milk, definitely we will not absorb iron properly. So we generally better if away milk from our iron food, or if we take medication, iron medication, better to avoid like 2 hours away from calcium containing, like milk, cheese, all this better to be avoided within 2 hours. This I think that's all need to put in our mind.
Definitely, that was a very useful point for all the viewers, because many of us are not aware that this is how we can take iron-rich food. Yes, that is very important for all. The doctor, we spoke about the causes of anemia, what are the tests to be done, and how important it is to detect anemia. How to manage anemia once it is detected?
Yes, this good question. Actually, iron deficiency anemia is not final diagnosis, rather than it is indicative for underlying etiology that make low iron or increase in iron need. So our management can be divided into two. First, treat iron deficiency anemia, and to search the cause and treat the cause. Okay, to prevent recurrence and further complication could happen. So in iron deficiency, Anemia usually it is treated by iron supplement. Iron supplement could be as oral intake, like orally we have different type of iron salt like ferrous sulfate, ferrous gluconate, ferrous fumarate. All this can be given orally. The problem is orally is sometimes it has more side effects, especially in gastrointestinal tract. For example, constipation, gastric upset, stomach pain, epigastric pain. So most patients, and the important thing, sometimes it causes constipation. So most patients maybe not taking in, or they start to take after that discontinue. So not will be good compliance for that, but it is very first line and very effective. And also when we given treatment, we should know that treatment should continue from 3 to 6 months. Why? Because once we have anemia diagnosed in our body, your hemoglobin start to decrease. This means we don't have any store, because first our body it utilizes as storage of iron. After that, if no storage, it affects. Hemoglobin will be dropped. So to increase hemoglobin it start to increase like 0.2 to 0.3 gram per deciliter if good absorption happen. Okay, so if we get optimized level of hemoglobin, we should continue from 3 to 6 months. Actually, not all the patients do this, because once they get hemoglobin level enough, or when symptoms disappear, the patient immediately stop medication. So still our body needs iron. So important thing, we should continue in iron supplementation from 3 to 6 months. This minimum 3 to 6 months. Okay, this first thing. If first line failed, I mean oral will not given, we can go for second line, which is parenteral iron. Okay, parenteral iron we have different types. Okay, and the parenteral iron usually if poor compliance for medication, or if patient have any gastric problem, if more side effect will develop, or if have any gastric surgery, immediately we should go for parenteral iron. Okay. And after that, if the patient have severe anemia, or if the severe anemia that affect is body function, example, if develop congestive heart failure, in this time, no time for waiting iron supplement to work, or parenteral. So we'll go for blood transfusion immediately. According to the level, we give how many pints of blood.
Doctor, also I would like to add on another question here. You spoke about underlying causes. Is this iron deficiency anemia related to any other chronic diseases?
Yes. Sometimes chronic anemia can be related to chronic heart failure, or people with chronic renal failure. Sometimes could be developed this way, or if they have irritable bowel syndrome, also this develop. Another thing could be also sign, as I mentioned before, for malignancies, especially GIT malignancies. We should rule out that in elderly women, in elderly patient, sometimes we need endoscopy to rule out this GI malignancy. You need to rule out. Very important. If we not search the cause, this means our management is not complete. We should find the cause. After that, if we find the cause, you can treat it safely, no problem.
Yes.
Thank you.
Doctor, thank you very much for such a detailed information on anemia. Doctor, finally, I would like to ask to sum up all these points for our viewers, like a message for them.
Iron deficiency anemia is a global concern. Okay, it is the most common cause of anemia. Generally, it is iron deficiency anemia. It is easily preventable. For example, if we take, we should encourage rich food iron. As we said, prevention is better than cure. But if anyone have any symptoms suggesting iron deficiency anemia, should seek medical help. And if any bleeding problem, also we should seek medical help to prevent, as we said, early diagnosis and proper management. It is very important to prevent associated complication of iron deficiency anemia. And thank you so much.
Thank you very much, Doctor. You answered all our queries and gave us detailed information on the topic. Thank you for joining with us.
Thank you so much. Okay, thank you for BMC Global Live. Thank you so much.
Welcome, Doctor. Definitely, this episode would have been a very useful and relevant one. It was one for me. I hope it was the same for all viewers. Take home all the message that doctor mentioned here. Prevention is definitely better than cure, reiterating that point. Also, let me give you a small reminder for those of you who haven't saved our helpline number yet. Please do save the helpline number, and as soon as we post the topic for the next week, do put in your queries by WhatsApp into that number. We will definitely take up those questions in the upcoming Health World episode. So we'll be back again next week, same day, same time. Until then, this is Mareena Francis signing off. Be happy, be healthy. Good night.
All your favorite products under one roof in Bahrain at 27-year-old Megamart and Macromart. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry. Our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
Lulu Money. Snehapurvam.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.